tea's been around a long, long time. We're going to talk about that and how that integrates with traditional Chinese medicine. But to tell you a little bit about OCOM, the Oregon College of Wellness and Medicine, has been around for quite a few years, nearly 30 years. Founded in 1983, and it's been in Southeast Portland for the majority of that time, actually just until September. And in September, we relocated to this space here, which is just a block away. It's on First and Peach. OCOM has many, many firsts. For instance, it's the #1 school in the country to study acupuncture and oriental medicine. It's been in the top 5 or top 10 for most of its existence, and this year it was crowned #1. So that's a first. OCOM graduated the first doctoral class. Up until 2004, there was no doctorate in this field. The terminal degree was a Master's of Acupuncture and Oriental Medicine. So we do undergraduate work and then go for a 4-year master's degree, which could be accelerated and done in 3 years. And in 2004, OCOM graduated the first doctoral class, was an additional 2 years of study. So another first for OCOM. And the program specializes in women's health and geriatrics. So the new campus, as I said, just opened in September. Really likes that spot. So the building's on First and Peach. If you haven't been by, I encourage you to stop by. It's a beautiful space. It's actually LEED Gold certified, so it's a very environmentally friendly space. We've got 400 students, faculty, and staff that are there. And the clinic that's there is, how many treatment rooms there? About 20?
I would say
About 20 treatment rooms at this space. About 20 treatment rooms at our old clinic in Southeast Portland. Plus we have several off-site satellite clinics. This clinic is the largest acupuncture clinic in the Northwest. High volume of patients come through. If you're ever interested in receiving care, there's acupuncture, there's a massage clinic, there's also just an herbal medicine clinic, and I'll talk a bit more about that today. And treatments are very affordable. You can see a faculty practitioner, somewhere around the range of $60. You can go in and see a student intern who's going to be working with a supervisor. And those treatments for an herbal clinic, $5 to sit down and have a consultation and have some herbs prescribed. Herbs would be extra. $25 for an acupuncture treatment. So it's a very affordable system of medicine here that we're offering.
Does the clinic, excuse me,
Sure.
does the clinic take insurance?
It's starting to, right?
the faculty practice definitely do, and I'm pretty sure that they're starting with.
So they take like Medicare?
Medicare is not a covered benefit. It does not have a covered benefit for acupuncture. So fortunately, that would not work. You'd have to have a secondary that was actually functioning to cover acupuncture.
I don't know if my secondary has coverage
Yeah.
either.
Oftentimes we have to defer. My private practice, the majority of my patients are insurance-based. Medicare is primary. It's not a covered benefit currently. Hopefully that will change in the near future.
Not the meant to do that.
First, AOM of Acupuncture and Oriental Medicine. So the first AOM school with federal funding from the NIH. The first school with a functioning research department. We're currently one of 3. 2 of them are here in the Northwest. Actually, NCNM isn't just which is across, actually it's on this side of the road. The National College of Natural Medicine has a research department, but they're not a standalone acupuncture school. They train naturopathic physicians as well. And we've been involved with numerous collaborative and solo research endeavors. And that dates back to the late 90s. So 10-year history. So why is OCOM talking about tea? Why am I up here from OCOM talking about tea? Well, one of the points I wanted to get across was that as an acupuncturist and as an institution training acupuncturists, we're teaching students much more than just acupuncture. We train individuals in herbs. Tea is considered one of those herbs. We train individuals in forms of massage, nutrition, associated techniques such as cupping or gua sha. So it's much, much more than just acupuncture. So today I wanted to just cover some basics so you can get a sense of how tea fits in from an East Asian medicine perspective or traditional Chinese perspective. So some basics of traditional Chinese medicine and Chinese herbal medicine, some of the traditional uses of tea, with or without the combination of other herbs, and then what the current science says about tea. Please interrupt me if you have any questions. Do you know anything about Chinese medicine?
I've seen some of the basics, but I'm always happy to be refreshed.
Okay. Have you folks ever had acupuncture? Or?
I've had acupuncture a couple of times in my life.
Okay, so you have some experience and exposure to some of the
And I
terminology
had a
here.
cousin who got very interested in that and actually became an acupuncturist and had some kind of certification to work in a hospital
Yep.
in New Hampshire
Oh, New Hampshire.
with abuse patients, substance abuse. She worked with alcoholics and drug addicts.
Oh, that's good, because New Hampshire was a hard state to crack
She
as
was
far as
on
getting
the
licensed.
New Hampshire, Massachusetts board,
Okay.
and she had quite a reputation. She was fairly well known,
Oh.
and I think one of the hospitals she worked in was over there. I know she had an office in New Hampshire. for a while.
Okay. Wonderful. My home territory. From Boston.
Pardon?
I'm from Boston originally.
Oh, me
so
too.
My home territory. Plymouth actually is where I grew up.
Yeah, she lived in Greenfield for a
Oh,
while,
okay. More
a
central.
long time. Now she lives in, it's not Amherst, I think, what's the town next to it?
Nashua, maybe?
No,
Around that
on the
area.
Massachusetts side.
Oh. Oh. Good, nice area. Nice area. So as far as the theory, it all comes back to this concept of yin and yang, not yang but yang, is a more appropriate pronunciation. Yin and yang, and with appropriate balance and harmony of yin and yang, qi is produced, our vital life force, and the vibrancy that we all have. Another concept of traditional Chinese medicine relates to the 5 elements. What's out in nature? Fire, earth, metal, water, and wood. You see here a generation cycle that one creates the other. And there's a controlling cycle. Metal controls wood, wood controls the earth, water controls fire, fire controls metal. So things are in balance and harmony. And we can then plug this in and overlay the body for this and use this in our diagnostic principles. So we come back to these general principles time and again. 5 elements and yin-yang theory. If you've had acupuncture or herbal consultation, you've had your pulse read. And with the pulse, we're feeling 3 different positions on each wrist. On the right hand, you have your lung, spleen, and kidney. On the left hand, heart, liver, and kidney. Each of these pulse qualities will help us correlate how to move forward with a treatment plan. And then you're familiar, I'm sure, with the meridians or the channels, which of course the body, usually from the hands to the face, or from the face to the feet, or from the chest out to the hands, or from the chest down to the feet. We also look at the tongue. Some of the colors are quite different. Looks very pale on that screen. When we look at the tongue, or palpate the abdomen to get a sense of the internal function, the balance of yin and yang within the body. And there's various tongues. We look at the color, we look at the coat, we look at the shape. You can see thick coating here to really thin coating here, yellow coat here, a swollen tongue here with spotty coating. So all of these things are clues for us onto the internal balance of yin and yang within the body. I wanted to tell you all of this information to just help you understand this one concept, this axiom of one disease, many patterns, one pattern, many diseases. This is what traditional Chinese medicine is based on. And the concept is the pattern of disharmony can be reflected in many biomedical diagnoses. So we might say somebody has a blockage, a stagnation of qi in the liver. That would be their pattern. One pattern, many diseases. That pattern could manifest as chronic fatigue, or diarrhea, or headaches. So I could have a patient come in, I have diagnosed migraines from my doctor, I have diagnosed irritable bowel syndrome, or I have diagnosed chronic fatigue syndrome. And they all have the same pattern, liver qi stagnation. But none of them have overlapping symptoms. You flip that around and you can take headache, for instance, we're trained as practitioners to recognize the possibility of 10 different patterns of headache. Somebody comes in, I have a diagnosis, chronic migraines. I'm instantly thinking, which of the 10 patterns is this individual? This is very different than a Western approach. And this plays into then the choice of herbs. Does that make sense? This is a really key, this is the key difference of this approach to medicine versus a biomedical approach to medicine. I use this slide way too much, but I enjoy this slide. So I wanted to just talk to you briefly about acupuncture. You've not had acupuncture? Yes, okay.
Have you had treatments? I have.
You've had treatments. This is what an acupuncture needle looks like. You usually use a guide tube to insert it. They're very, very thin devices. Here's one of my hairs that I plucked out. It's not much thicker. They come in these little packages. They're surgical, stainless steel, and they're sterilized. They're FDA-approved devices. We all use clean needle technique to reduce infection. Infection is very, very rare. An important thing that's happening nationwide right now is that we are in legal disputes with some organizations to limit their ability to practice acupuncture. We go to school for 4 years, as I said, to get that master's degree. Some individuals, like physical therapists right now, are saying they can go and study 12 hours and then they're licensed to practice acupuncture.
Not on me.
What's that?
Not on me.
No. Right. So currently in the state of Oregon, only LACs and MDs are licensed to practice acupuncture. So why do I keep talking about this? Because as an acupuncturist, we refer to ourselves most commonly, I'm an acupuncturist. It doesn't mean that's all we do. We are the gatekeepers to herbal medicine, traditional Chinese herbal medicine. If you want to know if somebody is really trained in Chinese herbal medicine, you look for these symbols after their name. A diplomat in Chinese herbal medicine, or for me I have this, a diplomat in Oriental medicine, which means I passed the Acupuncture National Board plus the Herbal National Board. This means somebody just trained in herbal medicine, very, very rare. They're not an acupuncturist, but they're a Chinese herbal medicine practitioner. This is rare. So this is what you want to look for. In the state of Oregon, you do not have to have a diplomat in Oriental medicine to practice Chinese herbs. You could go to an acupuncture school in another state, not study herbs at all, come here, learn on your own, and start prescribing herbs. It's a very complicated form of medicine, so I'd encourage you to find somebody with these credentials. And you'll find those folks at the Oregon College of Oriental Medicine. So we are a practice with many names. You'll see folks use any of these terms. They're interchangeable. Traditional Chinese medicine, traditional Japanese medicine, acupuncture, Oriental medicine, acupuncture, or traditional East Asian medicine, which is the one that I prefer. And as I said before, it's many, many things. It's not just acupuncture. Chinese herbal medicine dates back a long, long time. Earliest records were from the Milley tomb, which is 168 BC, documented 51 different herbs for the use of treating ailments. But the most comprehensive book is from the Shenan Ben Sao Jing, the Divine Farmer's Materia Medica, 365 herbs, one for every day of the year. This is a book that was compiled possibly by the mythical individual Shenan, who is known as the father of agriculture, father of herbal medicine in China. The original book was lost. There are some scraps of that book, and it was recompiled years later. Chinese herbal medicine uses the same concepts that I explained before, pulse diagnosis, just like with acupuncture. Pattern differentiation. But there's a difference with herbal medicine. The Chinese are one of the only societies that I know of that have gone to great detail, one of the only cultures, great detail with their herbs and with their food. They treat food as herb, food as medicine. Every single herb, whether it's Chinese date, datsa, or I believe this is catnip, jingjie, some mint, some bofa, this is premature wheat, maya. Regardless of what it might be, they categorize its flavor, its nature, which channel it enters, and its properties, the actions. What does it do? They do this with every single food item that you can think of and every herb that exists. And then herbs are administered as a traditional tea, like you're drinking today, as instant tea, or as these little prepared pills. And that's the same for food. Ginger. You've had ginger tea, I'm sure. It's an herb. It's a food. Crosses the border there. Shenjiang is how it's known in Chinese, or Shokyo in Japanese. Properties, it's acrid and warm, not surprising. You've had ginger tea, it's very spicy. It enters these channels, the lung, the spleen, and the stomach, which is primary digestive functions, but it also can alleviate cough. Good to boost the immune system. Same principles for tea, known as cha, in Chinese and Japanese. The property of tea is actually cool. Green tea is cooling for the body, not warming for the body. Just because it's a hot beverage doesn't mean that it's hot or warm. Green tea is cooling. Enters many, many channels. Not surprisingly, good for fatigue, good for headache, good for stomach pain also. So it's the Camellia sinensis plants. And there's numerous types of tea. Second most consumed beverage in the world. Number one is beer. No, water, yeah. The second most consumed beverage in the world. Numerous reported health benefits of tea. We're going to talk about those today. But you know there's 5 types of tea. This is green tea. Have you been in the tea house? Talk tea over here. There's white teas, there's green teas, there's oolong teas, and then it gets confusing. Here in China, they call it red tea, what we call black tea. Here in China, what they call black tea is what we call fermented tea, like pu'er. Yeah.
One of my favorite teas is a red leaf tea from Africa. Rogos. Yeah, does that fall into any tea?
No, because that's not the same. It's a different plant. Different plant. This is talking about Milley plant. So there's 2 main types of that. One from India, one from China. We're going to focus on the blacks and the green teas. People talk about caffeine levels, right? White tea is going to have the least amount. Black tea and fermented tea is going to have the highest amount of caffeine. Makes sense, right? Except that's wrong. It's actually not very accurate. Caffeine complications here. If you think that you're getting less caffeine just because you chose a green tea than a black tea, it's not necessarily the case. It depends on many, many variables and factors. So those are averages. The average cup of green tea, but that's based on tea bags that are sold, and that's usually not a high quality tea. So if you want to reduce your caffeine content, the surefire way, if you ever go to a tea house, you'll see that they pour their water over the tea. And if they have nice cups, they put the cups out and they'll pour that out all over the cups and pour that cup butter over the teapot to age that teapot and give it a nice patina. But you pour out that first steeping, you don't drink it. That washes the leaves, prepares the leaves. Depending on the temperature that they have and depending on how long they leave that in, that's going to decrease the caffeine content for that tea. So you get more of the health benefits with all that caffeine. Most of that caffeine is extracted in that first 30 seconds or so of that tea. So you wash the tea first, then you pour more hot water over it, and then you start drinking your tea. And you might do 2, 3, 4, even more infusions of those tea leaves. So caffeine content. You'll see Assam, black Assam tea. That means it's from India. So the Indian, this is going to have a higher caffeine content. The Chinese tea is going to have a lower caffeine content as a generalization. But depending on its orientation to the sun, the soil chemistry, all of these things will have an effect on the caffeine content. So don't be fooled thinking, oh, I'm going to get less caffeine and go with green tea. It depends on all of these factors. I wasn't sure what it was going to be like today. I thought we'd have many different tea samples from the Tao of tea. And I was going to have them pour some tea. And we're going to try a little meditation technique. Today because we don't have all these different teas to enjoy. But I will just share, since I put this slide in there, if you're thinking about the concept of mindfulness and really enjoying your tea, sitting down and enjoying the aroma of that tea, the flavor, the nature, seeing what channels it enters, really truly enjoying that tea, embodies this concept of mindfulness. And there's been a doctor, John Kabat-Zinn, who's really pioneered the concepts of meditation, Zen meditation. And he's used the term mindfulness-based stress reduction to be able to share this with other docs as a means of originally decreasing chronic pain in individuals, but intractable chronic pain. Nothing was working for them. And they found that an 8-week program of doing these techniques is very, very successful, not only for reducing chronic pain, but for boosting the immune system. So enjoy the tea. That's the concept there. Great Japanese proverb.
Is that the tea looks like growing in the field?
Those are tea fields. Yeah. Well manicured there.
Yes.
Many famous books. One of the most famous books is the Tea Classic, the Chajing, 750 AD. The Book of Tea by a Zen Buddhist monk. The Kisa Dojoki talks about the benefits of tea. This was written around 1150. Then we have, to modern times, formulas that we use on a regular basis. And this is where I'm going to start to blend some of the concepts of tea as an herb. So one of the most common formulas that uses green tea is called Chuan Shang Cha Tiao San. Cha, tea. Chuan Shang is this herb that you see here, the Visticum. Very, very commonly used for headache. Interesting that caffeine has a nice dilatory effect and can be good for folks with migraines. There's 8 herbs that are in this: mint, boba, and the Visticum, which is Chuan Shang, are the two emperor herbs. They work very, very effectively, and if you combine that, you crush all those up, combine it with green tea, very commonly used for headache, any type of headache, but especially if it comes on suddenly. So a quick migraine that seems to attack. Another traditional use of tea as an herb is if you get a common cold. This is called ushicha, noontime tea. And you see it says releases when cold. That's what we call a common virus. So East Asian perspective of wind and cold, 2 elements enter into the body quickly. If you have a cold, it's going to be wind cold or wind heat. Right now, it's going to be a wind cold invasion. You're going to see one of us, and that's what we're going to call it. We're going to give you herbs to release wind and cold. Black tea is one of the main ingredients that can help to do that. Black tea is a bit more warming than green tea. Green tea has that cooling property. This is a very commonly used patent pill, so it's pre-made. You can get this in many shops. In the Northwest, I prescribe this formula on a very regular basis. Samoritsa-san, xanthium powder, the cockleberry. This is xanthium. Releases wind, alleviates pain, opens the nose. We use this for chronic sinusitis or allergic rhinitis, seasonal allergies. 4 herbs, then you brew green tea and green onion. Grind those herbs up, make that brew green tea and onion, throw the ground herbs in there, and drink it down. Today, we have this in patent form, so I just advise patients to make a cup of green tea, take the pills, and drink the green tea. If they're adventurous and they have a good palate, I have them throw in the songbai, the green onion, which is just the white parts of the green onion. Has anyone drank that before? You've eaten it in soups and things, misos. And this is very, very common for those allergies. Another use of tea. Has anyone had ochazuke? Anyone's had ochazuke? This is a great meal. It's easy to make. You can even buy it in pre-made packages at places like H Mart or Wajimaya, the Asian markets. So ochazuke, cha, tea, and then tsuke means like to to pour over or to be buried. So it's simply rice, steamed rice. They usually have salmon, some seaweed, some more here, some sesame seeds, maybe some, I don't know, some green onion, and then you pour green tea right over it. You make this, I don't usually put this much tea over it, I just let it get kind of soupy, but not this much. And then you enjoy it. You get the health benefits of that green tea. It's nice and warming for the yang energy, and it nourishes your qi. So it's very, very helpful on a cold day like today, a damp day. This would be a common meal. Another common use, does anyone have the chai down, Chinese tea eggs, or?
They serve them in the tea house here.
They do, oh, they do. Have you had those?
No.
Oh, you'll have to go
I
try.
was going to ask, does the tea house serve tea?
Yeah, right here. Wonderful. It's the Tao of Tea, which is a local tea shop here in Portland, and this is one of their locations. The other location's on Belmont. I didn't know they served these here. So typically you use pu'er, that black tea or fermented tea. The Chinese call black tea, right? They call it, it's red tea, then black tea. Pu'er, so it's fermented tea. Pu'er kind of translates into camel's breath. Gives you a nice, yeah, give me some of that tea. It's actually very good tea. Aged tea. So you combine eggs with pu'er, some anise, cinnamon, a little bit of soy, a little bit of water if you want, and then you let it soak. To get this marbled picture, what you do is you hard boil the eggs first, if you want to do this at home, and then you lightly crack it after it's boiled. Lightly crack it, and then let it soak in this mixture of the tea and everything for about 6 hours. Then you can eat the eggs, and usually you'll serve the egg in the tea. You'll strain out that tea, and you'll drink some of that. Get the nourishing benefit. Also warms the yang and nourishes your qi, builds the qi. And then you get the nice protein from the egg. And if you eat too many of those, then you can try some tang, which aids digestion from overeating. So this is a common formula. 3 herbs, walnut, that chuan chang again, which you could buy from Ocom if you really want it. And perilla. Does anyone have perilla? To see it? You've eaten sushi before. You have ginger usually, aids in digestion. Perilla is another thing that's very, very common to have at the end of sushi. It's a green leaf. It's usually wrapped up, and you'll have some plum inside of it with some rice. I forget the name. But just so we have a plant growing out in my front yard. You can grow it here in the Northwest, and you can just eat the leaves. Very, very nice for the stomach. But if you combine these 3 things, cook them in the tea, and then add ginger at the end, it's going to aid digestion. Again, another good use of tea. They like their tea. Teetotaler, you know that term? Where that comes from? Back in the day, you had 2 choices, right? You were drinking tea, or you were drinking booze. And if you didn't drink booze, you drank tea in total, you were a teetotaler. That's good tea. So what health benefits have you heard about for tea? Any of these look familiar?
Well, it has antioxidants.
Antioxidants, for sure. Stimulant, maybe for weight loss. The antioxidants would be good for inflammatory conditions, cardiovascular diseases for sure, potentially cancers, maybe different types of cancers. Any other things you've heard in the news lately? No?
What about that question of adding milk? I've heard some people say that decreases the benefits. What's your opinion?
There was one study that was done in Germany. I can't look at the study because it's in German and I don't read German. And they found that the components of milk actually block the absorption of the key flavonoids in black tea. Then it can give you the antioxidant benefits and the fat-reducing benefits, is how the Chinese refer to it, the cardiovascular system. to reducing cholesterol basically buildup. So it's advised actually not to
So,
drink.
so then we just cow milk or soy milk in the same category?
I don't think soy milk would be in that category. I think it's common.
Cow milk.
Yeah. I have different opinions on soy milk. That's for.
Yeah, no, I understand.
Yeah, so right now the general recommendation is if that's why you're drinking the tea, if you're drinking 4 to 5 cups of black tea for cardiovascular benefit, don't add milk. Do not add milk to it. Well, possibly reduce the mineral benefit of that tea. There's only been one study on that, though, and as I said, I wasn't able to look at it. It's interesting. So you mentioned the antioxidants. Green tea is usually higher in antioxidants than black tea. Those antioxidants come in the form of polyphenols, which are also known as flavonoids. And you've probably seen the word catechins, or this mouthful, EGCG. Epi, gallo, catechin, gallate. Does that look familiar? EGCG? No? Okay. This is one of the common ingredients, most common ingredients of tea green tea that's being studied for use in cancer prevention, cardiovascular disease prevention, stroke prevention, and the like. Green tea is higher in antioxidants. That's a general consensus. That's a general opinion. Here's the difference. Green tea, black tea. They're both fairly high, but there's different components in each. They'll have different effects on the body. Much like the caffeine, to say green tea is lower in caffeine than black tea, it's a bit of a misconception. It can be. Same for antioxidant value.
Does it matter if it's hot or cold tea?
You know, it's an interesting question. I'm not able to find much literature on infusion rates. The general consensus is to get a better infusion and to draw out those active constituents you want hot water or boiling water. On the same token, if the tea is overboiled and it's too hot of water put on, scalding water, you can scorch the tea and then you won't draw out some of those antioxidant benefits. So I'm not able to, from a scientific perspective, from a research perspective, say, yes, you are going to get a higher concentration. I can't find that literature.
Okay, because if you make
But-
cold tea from hot water, from hot tea,
Then that's okay, because you've extracted out those active
Would you
constituents.
be
And that's
fine
generally
with
what I
that?
recommend.
Mhm.
Yeah, if you're going to do it, boil the water, let it steep for the amount of time you want, then you can put ice cubes in it to dilute it down.
Mhm.
Or just let it sit and cool. But you really don't want the tea leaves sitting too long, because then it gets bitter. So some of the research that you might not have heard of: topical use, genital warts, as well as human papillomavirus, HPV. There's actually some very good research suggesting that this concentration of green tea, those flavonoids used externally, is very, very effective. Talked about cancer. What types of cancer? Ovarian cancer. Wow. A fair amount of good research suggesting that green tea is beneficial to help prevent ovarian cancer. Men's health, prostate cancer. It's a really exciting research looking at EGCG, that component, that flavonoid of green tea, combining that with current medications like tamoxifen, and finding increased effects of that tamoxifen. If you were to go on the National Institutes of Health website and go to the National Center, the National Cancer Institute, you'll see their sheet on the benefits of tea. And their general recommendation is not enough research has been done to make a recommendation one way or another. But if you look at the dates of these reviews, these are more recent than what's current on the National Cancer Institute's website. So they have a little bit of updating to do. There's some very promising literature that's out there. These are reviews of research. So these aren't individual trials. These are a collection of numerous trials. They review those and then make a recommendation. So it's a fairly strong evidence. There's some promising evidence you've heard about its protective effects for cognitive function. So age-related neurodegeneration, some promising research. And breast cancer, there's some mixed evidence out there that's from 2005 We look at black tea, not EGCG, but we're looking at theaflavins, or TF is the acronym that you'll see for those. So theaflavins are the active constituent that people are researching. We have some strong potentials for cancer prevention as well. The ability to not allow HIV to replicate, and also for the cognitive function, dementia. Fair amount of research for cardiovascular disease and also for stroke. Leading cause of death in America, cardiovascular disease. We have risk factors that we can't control. One of those is age. For men, once you hit 55, there's a risk factor. Family history you can't control. There's a second risk factor. For women, once you hit 65, that's a risk factor for developing cardiovascular disease. Some of the other modifiable risk factors are weight, blood pressure, cholesterol levels, unless it's genetic, diabetes, smoking, but things that are within our control, things like having some black tea on a regular basis. And then that recommendation, as you asked about the milk, I would say, don't have the milk. Cancers, ovarian cancer. And they looked at black tea versus coffee. Better benefits with the black tea. Parkinson's disease. Slowing the progression. Potentially lessening the incidence. Japanese versus Chinese teas. Black versus green tea. Black tea seems to be more beneficial. There's lots and lots and lots of research, and I didn't want to bore you with all those studies. I wanted to just give you a brief summary and a stroll through those. And let you know that mostly the research has been done on green tea. The vast majority of research out there is on green tea because of the general notion it's higher in antioxidants. And or its flavonoids, that EGCG, which is that active constituent in green tea that seems to have most of its beneficial properties. But that's not the whole story. If you just extract one substance out, you're missing the totality of it. You've interrupted the yin-yang balance of that herb. And from an East Asian medicine perspective, that's not the most appropriate use of that. You should be using it as it is naturally. You should be using the whole tea, from my perspective. But doing some interesting research on just this active constituent might give us more information of how it might be applied. Same thing for the theaflavonoids from the black tea, TF. Most of the trials that have been done with green tea or these active constituents, green tea or black tea, are done on animals or they're done in a laboratory. But recently there's been some very large-scale epidemiological studies studying population for periods of time and finding benefit. That's very promising. Promising results for cancer prevention, breast cancer, prostate, and ovarian. External applications, the genital warts, possibly sunburn. I didn't put the research up there, but there's been a lot of folk memories, people using green tea bags and helping to soothe the sunburn. Promising results for heart disease and stroke, Parkinson's disease, cognitive function, and then that exciting research combining tea with current medications. And that's very interesting to me. So synergistic effects.
I don't know what the properties are, but when I had oral surgery, and if something starts to bleed after the surgery, the dentist has always told me to put a wet tea bag on with something about, I guess, the tannic acid.
Tannins.
That stops the bleeding.
Yep. Yep. And actually, there's even some research to suggest if it's more invasive, that tea can help strengthen bones as well. I didn't present that literature, but both of those things, yeah. External applications. So what's my recommendation? When they study these populations, I say drink at least 4 cups a day. If you want to get these health benefits, it doesn't mean drinking 1 cup when you feel like it. You have to commit to drinking tea. You have to be a teetotal. one of the more recent trials that came out of Japan linking reduced incidence of cardiovascular disease to green tea consumption. Take a guess at how many cups of tea they were drinking a day.
8.
Yeah. 8 Japanese cups a day. So small cups. You're drinking it all day.
So what's your recommendation how to deal with the caffeine issue? Because a lot of people are sensitive to having trouble falling asleep. As you said, it's method of preparation. You can take off some of the caffeine.
So that first infusion, definitely you can pour that first water steeping out.
Yeah.
Get the next water steeping in, drink that. Don't let it sit for too long. That can be one way to do it.
So you just.
And then do multiple infusions
Okay.
of the same tea leaves.
So you just, pour the hot water over it and then just immediately drain the tea leaves and then go for your tea preparation?
Yeah, I wouldn't immediately pour it out. I'd wait a moment
Okay.
because it's that first 30 seconds or so.
30 seconds.
Yeah.
Less than a minute.
Less than a minute, yes. And then pour it out.
Yeah.
And then do multiple, excuse me, multiple infusions off of the same tea leaves will be beneficial because you continue to get the antioxidant benefits, but most of that caffeine is gone. It's gone after that first
Yeah.
infusion for the most part. It gets less and less and
When you're
less.
recommending 4 cups, can that be 4 infusions of the same tea leaves, or do you have to use
Yeah.
other tea leaves? You can
No,
use
do the same
infusions.
So I usually do 2 sets of tea leaves for the day. I do a set in the morning and then drink multiple cups throughout the day. And then I do a second set for later on. And you can experiment with different teas. We talked about all the different properties. So you can get the exact same style of tea, but it's from a different slope. It's like picking out wine. You could go to that vineyard, and this terroir is perfect, but 8 feet over, not so good.
Yeah.
Same thing for the tea plant. So you might get that same brand, and you might go, wow, that is really strong this time. And then the next batch you get, pretty mild. So it can be interesting, but usually you can find a style of tea that you like and agrees with you. So drink tea daily. You have to drink at least 4 cups would be my recommendation. Our cups are larger than Japanese style cups.
Is
They're
that the
smaller.
size of the Japanese cup?
About.
Like 4 ounces?
Yeah. And even the Chinese, anyone traveled to China or Japan? Yeah. It's like when you go to a traditional tea house here, you're going to get a small little cup. And then you get you're pouring a tea, and it's like a shot glass. And you can pump hot in it, and you can throw it down if you want. So it's small little shots. So you're drinking lots and lots of cups. A recommendation would be, remember I talked about the 5 elements of traditional Chinese medicine. The yin-yang theory of the 5 elements, the water, the fire, the earth, the metal, the wood. That's about balancing with the seasons. So harmonize with the seasons. The black teas and the oolong teas are a bit warmer for us right now. So not only do you get the health benefits of the tea, but you get the immune health benefits of having something that's in with the season versus having a green tea, which is a bit more cooling in nature. So today that should have been an oolong instead of a green tea. That would have been a better choice.
What about adding honey? Does that affect the health benefits?
A few of the trials that I found did suggest that adding sugar can diminish the health benefits. I didn't see anything on honey. I just don't think it's been studied. Much like most of the research has been on green tea, and most of the research has been on either the theoflavonoids, theoflavine, or EGCG. Those are just the active constituents. It's not the whole picture. And just because that's been researched, that's all that we know. But there's much more to the picture. Just like maybe adding milk gives you other benefits. It might not be the best thing if you're looking at specific cardiovascular functioning and being able to decrease cholesterol levels. Having black tea greater than 4 cups will lower cholesterol levels. There's been a few trials to do that. Although it's not large, it is statistically significant. But when you add the milk, they're saying it doesn't seem to have that effect. But maybe there's another benefit. It just hasn't been studied.
I think a lot of people would say just on a sort of an aesthetic level, the milk decreases that astringency that sometimes is hard on your tongue if you're drinking multiple cups.
Yeah. And that's why people often do that or sweeten it and add sugar.
it gets very, it gets kind of puckery if you're just drinking regular tea cup after cup.
And then others, purists would say, if you were to go back to the classics, if you were to have Lu Yu, or this is Issei, they'd say, what are you doing adding anything to your tea? That's blasphemy. Drink the tea like it is. And if it's too bitter for you, it's probably not a good tea. And so if you're getting tea bags and that's what you're judging, oh, it's kind of bitter, it's often not a high quality tea. So you have to come down, it comes down to quality sometimes. A loose leaf tea that's been hand-picked, dried appropriately, aged appropriately, roasted appropriately, it's going to have a much better taste and be easier on your palate than something that's just in a tea bag. Often, not always, but oftentimes those cheaper teas that are bagged, it's kind of like a hot dog. Take the scraps and just bag it, and this is what we'll do with it. So that's something to consider. So we had those promising results. 4 cups, harmonize with the season, and that's basically what I was saying here. Consult your local tea shop for selection and brewing. Because Portland's blessed with several really high quality tea shops. Tao Tea is one of them. And then combining tea or using tea, thinking of tea as an herb, as it fits into the concept of traditional East Asian medicine. So come see one of us. Come see an herbalist. We can balance out formulas. We often add all sorts of things that taste very nice. So if the flavor of tea is an issue for some folks, we'll add natural sweeteners like goji berry, or maybe the licorice, maybe citrus peel, maybe ginger. We add those herbs in and balance it out for the individual. So oftentimes when somebody comes to see us, acupuncturists, they come in expecting acupuncture and they leave with herbs. I want you to go drink tea on a regular basis, and I want you to put in your tea these things. You want to put green onion in my tea? Yeah, try that. Instead of taking that Bayer migraine pill, try drinking a strong black tea with some green onion. Or here's some logisticum. I want you to go home and brew some of this and try that with your tea. See if this works for you.
So do you mostly use the capsules, or do you use actually the raw materials?
Most often I use those patent pills.
Yeah.
A little pre-made, it's just more convenient. But a lot of folks do enjoy the tea, and they want to see the herb. They want to see what it looks like. They want to get those flavors. Those folks I use the bulk formula, so I have a few of those around.
So if somebody is a chronic migraine sufferer, would it be beneficial to have a tea potion that they drink regularly to do it prophylactically?
Both, yes. Yeah, so my patients that are coming in, majority of them, they're doing acupuncture. If you look at the evidence for acupuncture, it's very effective for the treatment of migraines. But I also put them on herbs, and I do that prophylactically, and then they'll have a different formula, like maybe the black tea, if they're okay with caffeine, black tea with lugisticum, the chuan shang. They'll do that if needed. They wake up and, whoa, it came on anyway, take some of this and try that.
For a person who is close to the idea of acupuncture, would the tea work alone?
Yes.
Migraine?
Yeah, it can. And I do have some folks that come in, they don't have, for instance, insurance benefits for acupuncture. And so more cost-effective option is just to do an herbal consultation, and we just do herbs. So it can.
And all the herbs have to be fresh brewed, or
They do not, because you can get those, the pill form, pre-made. So they do not have to be fresh brewed. It's a bit more work and a bit more of a commitment if you want to do traditional teas. But there are pre-made pills. And then there's granules, there's pre-ground. So it's like instant coffee. It's instant tea though. So we mix it all together. So if you haven't brew it, you go home, throw a few scoops in, add hot water, you have your instant tea.
yeah.
It's a flavor issue for most people because of the flavors, like you were talking about the bitterness of some of the teas. Well, now you're drinking true herbal tea. And when you buy an herbal tea at the supermarket, it's manufactured to sell, so it has to taste good. And there's a saying, it's an axiom in Chinese medicine, sweet medicine doesn't work.
So Mary Poppins was wrong.
She was wrong. Well, no, you do need a spoonful of sugar to make the medicine go down. She was right in that aspect. The medicine usually doesn't taste very good. But they have unique flavors.
Do teas help with asthma at all?
With asthma, yeah, acupuncture and herbs can be effective. I go more in the herbs in that arena. You use the acupuncture to assist the body overall. But yeah, I have an individual right now who is a week away from taking off for New Zealand. A woman who's in her mid-60s who has exercise-induced asthma that's come on later in life, the past 5 or so years, getting great benefits right now. So still uses an inhaler, but only uses it maybe once a day with very strenuous exercise.
So she doesn't take any asthma medication, Western.
Nope, just uses some herbs now.
Wow.
And uses the inhaler only when she's going to be climbing hills. Otherwise, so like Pittock Mansion, been at the Pittock Mansion?
Yeah, not
You know that hill? That's a steep hill. She's going to climb that, training for her heights. She'll take a cough.
So how long of being on the herbs?
Month and a half.
A month and a half only?
Yeah, it's pretty quick.
And
You
she's
figured out
still
her
there?
pattern correctly. The pattern differentiation. You got her pattern correct right away.
Because I
Sometimes it
have
takes a while.
allergy-based asthma that I never had until I moved to New Jersey.
Yeah. Okay, I'll talk with you soon. Yeah, so for that, you know, we look at the idea of the manifestation, the allergies, and why is that happening, and we can work with that. So I work with individuals on that. And then you can work with the manifestation of the asthma because of those. Yeah, so there's excellent herbalists at OCOM. You can go in, as I said, it's $5, you sit down. You're going to get a supervisor, a very experienced practitioner, and then you'll have a group of students sitting around learning from that practitioner. And then you just pay for your herbs. Maybe about $10 a week. So you'd be looking at. You'd have your herbs. So, yeah, it's a great option. It's just right around the corner. Any other questions about research, the science on this? I could talk for days on that. I tried not to put much in there. I wanted you to get an overview and some context, and then give you a hint at what some of the science says. Some actually strong evidence. I hadn't looked into a lot of the tea research in the past. Acupuncture research is really my specialty, but I was actually very surprised at the level of evidence that's there for some of these conditions. I always thought it was more just, well, yeah, it's good for you, it can be good for you, it can be good for you, but what we're finding is there's something to it. There's really something to it. So you have to be a teetotaler. You have to drink a lot of tea. Yeah.
What about for children? And you don't want to really give them caffeine.
Yeah.
Is there anything that,
That they could be doing. Well, that's where some of the single components come into play, and that might be one of the reasons why they're starting to look at that. Plus the fact that you don't have to drink 8 cups of tea, you can just take an active ingredient, so the EGCG, and say, okay, you can take this and get the active benefits. Well, the general idea for kids is we use other forms of medicine and other herbs. If we look at the herb tea in and of itself, it's very stimulating, so we'd always want to balance it out with other herbs. So if we were using that for an individual, for a child with a cold, we'd combine it with other herbs to help calm that down, balance out the yin and yang nature. Tea would be yang in nature, very active, so that you'd want to add a more sedative, more calming type herb to settle that down. So yin and yang would then be balanced, and it wouldn't be such an issue. A great example of that would be with asthma. You've probably heard of ephedrine. Ma Huang in Chinese medicine has been used for a long, long time for asthma. We use Ma Huang not on a regular basis, but we use it fairly commonly with asthmatics, but in a controlled dose and balanced out with other herbs. It's very active in yang, so we balance it out with other things. We never use it by itself. By itself and in high doses, fortunately, it's been deaths. We'd never do it that way. We always balance out the yin and yang nature. Same with tea, balance it out. We'd probably just choose a different herb though.
okay. And what about with allergies such as gluten allergies? Is there any kind of,
No issues there with tea. Yeah.
Acupuncture was probably some of that digestion, wasn't it?
Yeah.
Did she have celiac or just the gluten allergy?
just the gluten allergies?
Yeah. So it could be celiac or it could just be more of a sensitivity. kind of a spectrum of things.
Well, thank you very much.
Yeah, thanks for coming.
Thank you.
Enjoy the rest of the day here.
Thank you very much.
Thank you very much.
Oh, thank you for coming.
Yeah.